So I'm recording now. I'm going to share my screen. I really appreciate y'all signing up for this. It does take quite a few faculty to pull this one off, but okay, so hopefully you're looking at my Blackboard screen. Everybody see that? Okay, so what we're looking at is EPC 3 for fall 2022. And I've gone down to week 2, which is where the lab is on schedule. You see
Not
that?
yet. Not
Okay.
yet. We're seeing Blackboard.
You're not seeing Blackboard?
We're seeing actually my LMU. We're not seeing the Blackboard shell just yet.
Okay.
I don't know about you all.
I moved it. I'm
There.
sorry. Yeah. Okay. I was trying not to be looking at 2 places at once, but this is my technological challenge. All right, so I went to week 2, and now I see giving the assessment plan. Can you all see that? Anybody?
Yeah.
Okay. So when we click on there, the overview of this activity is that it's going to be a small Zoom group, and you will, the students have an opportunity here to practice giving the assessment plan, delivering difficult news, and motivating behavior change. And when you start looking at the rubrics and the cases, it might feel pretty highly scripted. That's some of the feedback I got last year. But it does give them some place to start. And the PowerPoint lecture I presented on Monday is available under here if you wanted to go through it. But the real quick version of this is how and why we're doing it is to give the students a chance to start closing the encounter. It's just not something they get to practice much, and it's an important part of the whole thing. Without the closing the encounter, the SOAP, and their whole exam, everything they've done doesn't really carry any weight. So a quick example would be, okay, we're about out of time today. Is it okay if I summarize our visit today? And that statement is to orient the patient, the encounter's ending, and asking permission is if it's okay if I share this information engages the patient. It gets their attention that you're involving them. And then the next part would be, you mentioned you're worried about headaches, you think you might have a brain tumor. I know that's really scary. The good news is your physical exam is normal except for your blood pressure is elevated, and this might be causing your headaches. So this addresses their complaint, what they came in for, summarizes, and gives a diagnosis. And the purpose of that is to validate the patient's concerns and inform them about what you think is wrong. Did that just lose everything? Are you all still there?
Yeah, but
We're
we're
there, but-
looking at your screen,
It's just showing your desktop.
desktop screen, sorry.
Yeah,
At least it's not the blue screen. It's just the desktop.
just the
It's
desktop.
it's a blue desktop screen. Is what it
It's
is.
a blue Okay, let me get back to where I was. I just don't know how that happened. Okay.
See what I mean?
Yeah, I'm totally there with you, Anna. I think I had my paper on top and it just made everything go away. But here we go, back again. All right, so are you able to see that screen now?
Yes.
The Blackboard screen? Okay, I'll
Yeah.
keep my paper off of the laptop. It's very sensitive. So tell me what you know about high blood pressure. And this is what we're trying to get them to use, is called the ART loop: ask, respond, and teach. So asking them what they know about blood pressure, saying, yes, you've got that part right, but maybe that part's not quite right, and then giving them a little bit of information about blood pressure. Yeah, blood pressure can be, modified by your diet and exercise habits. Then planning with the patients to get them to buy into what the plan's going to be. So, how do you feel about changing your diet, starting exercise, adding blood pressure medicine? And then the final thing is closing the encounter, something that makes them feel good about what just happened, lets them know when to come back. So I'm glad you came in today. I'm looking forward to working with you on getting your blood pressure down. I'll see you back in 2 weeks. So that's the very basics. So the students are assigned one of 9 cases. The assignments are on this link right here, giving the assessment and plan schedule. And I'm just going to go to that really briefly so you can have a look at it. Can you see the schedule now? So you see for the 150, well, you have to scroll over here. Sean, I about had a heart attack yesterday because I thought that we had dropped a whole column. But 1 o'clock, Dr. Yantz has these 9 students, and each student has a case assigned. Does that make sense?
Yes, if you open that bigger, will it show more? Okay, never mind.
Well, you can follow along on your Blackboard and go to that schedule and see it full screen. I just wanted to show you where it was and how the cases are assigned. So the actual cases are that first item, and there are 9 cases, and you might want to just look through the cases so that when you're reviewing the video with the students, you'll know what each case was. So some of them are just closing a regular problem-focused visit. Some of these are advising patients about the need for behavioral change, and some of these are giving bad or giving difficult news. And I'm not sure how I keep on dropping the screen. So my advice when you are navigating a Blackboard for this activity, that you just use your back button and not X out of anything, which obviously I'm Xing out, so I keep on losing it. Okay. Any questions so far? So prior to the lab, the students are actually creating this video with addressing the cases assigned, and they're going to drop the video into a blog. So you can see the instructions they got are here, and then the blog is here. And when you go into...
Actually, I've got you set up. So click on that. That's actually a
Okay.
link blog page.
Yeah,
Everybody's got a blog now. You're the only one that has the entries currently. See the 9
Right.
entries?
yeah,
So go ahead and go into your blog page and show them how they will access it.
sure. So you'll click on your name, and when I see this little chevron right here, I'm going to click on that, and that will actually show me the blogs that are dropped for my students. I would go ahead and maybe print out your cases, your students assigned, so you'll know what cases, because these are not going to be cut out per session. So you'll have to correlate your student with finding them on here that you're calling on. So let's say I had Amber Park in my 410 session, then I'm going to go from my student list and look for her in this list of names. Does that make sense? I wanted to go ahead and go
Yeah, click
through a
one.
couple of examples because the blog entries are sometimes a little bit different. Some people are going to have just a case and the MOV application. Some of them are going to be YouTube. Some of them are going to be Google. This is the very hardest one. And I'm going to post a link on how to navigate this. But when you click on this, it's not going to just show you the video. What it will do is let you save the video. Okay. Now you might be able to play it straight from here because I've already done this, but no. Yeah, it's going to make me save it. And so down here, do you see this little video icon where it says K6 MOV?
Yeah.
Okay, I'm going to click that and it's going to open up the movie. Now, most of the other ones are going to play, but like I said, this is the worst case scenario. I just wanted to show you one.
Danielle,
Uh-huh.
one thought I just had, one issue we ran into last year with the students who make a YouTube video is for them to make it public, because
Yes.
if they have privacy settings, you have to stop, they have to go and change the privacy settings. So if there's any way
Yeah.
to remind them to
Yeah.
make sure that their privacy settings are turned off on the YouTube, that saves a lot of time.
Yeah, and I did ask them to make sure that it could be played, but I'll add that. That's a really good point. And if you run into one that just, is like that, skip to the next one. I mean, these are only 50-minute sessions, and that's including the time that you're going to be like taking roll and transitioning to your next session. So if it's not easy, then just go ahead and go to your next one.
And they're going to do all different types during their the session. There's the different types of interviews or different types of closings, right? They're going to have
Yeah, one will have a closing encounter. One might be assigned the case of giving difficult news. One might be given the case of motivating behavior change.
and the reason we've done this is again, course director wise, I'll speak just for a moment, is
Sure.
we're evaluating them, to give assessment plan. And we used to do the dumbest things, like we lecture on how to give assessment plan and then evaluate students. There's a cavern between lecturing and performing. And so the lecture has been delivered. This is a practice session, and then they'll start integrating that into their SPEs. And so this is a good chance to kind of see somebody else and be like, even though they're not forced to do every type of closing, they see it. They get to see their peers do it, and we get to give feedback, and we're like, oh, I would never do that. Oh, that's a very good idea. I like the way they did that, and their approach. And so that's the whole point of this lab. Don't overdo it. Just let them see the different variations of that. They're going to put a little bit of work in the front end and hopefully have a good afternoon. Does that make sense from the course director side? I wanted to give that.
Thanks, Chris.
Yeah, Kip, you got that? I saw you looking at me kind of like, what are you talking about?
So that, particular case, he did a pretty good job, but we can go back to the rubric and see, did he touch on everything? So he was obviously giving difficult news. The lab rubrics are right here on Blackboard, so you can look at giving difficult news and see that he really touched on those key points. And it's not like everybody has to do every,
You want to have at least 1 or 2 examples of each of the 3 types, right?
I'm sorry, what?
As a course, as a group facilitator, you want to have at least 1 example of giving difficult news, 1 or 2
Yeah.
examples, motivational change or giving the assessment plan. That way they can see some. You don't need to do everybody it's on your thing. You need to have at
Yeah.
least examples.
Yeah, it would be pretty impossible to get through all 9 cases in the 50 minutes. So we really want to do more quality than quantity on this. But here's an example of the giving difficult news template. So they should at least have had, show that they did these things. Preparing yourself to give difficult news, that's hard to see on the video, but you can probably tell if they did prepare by how they presented their video, right?
Don't close.
Don't
I want to
close
see
it.
that. Yeah, I want to
Okay.
see that. Well, just pull your document from down low. Well,
Yeah. Okay.
and I'll say this. I'm not trying to hijack your training, but
No, go for it.
the one thing I wanted to say was this is very well laid out in her lecture, but you know how students are. So I said, we need to create documents that basically hold their hand through this first phase, and they practice it. They basically fill their information in and do it. That way it gets in their head exactly a good format to follow. And that way they can do it better over time. And so we're really holding their hand here. But the flip side of this is really, it gives you as the facilitator an area to give feedback on. Did you add permission to share? Did you address the complaint? You didn't really talk about, you didn't really get patient understanding. So these are areas that you'd be able to look at and give feedback on post viewing of the video. Yeah.
Yeah. And hopefully the other students will give this feedback, right?
Yeah.
And then the faculty will just fill in, yeah, I agree with all that. And this is the other thing I saw that it was really good or that we need to work on.
What we're going to do is the very same thing, very similar thing for case presentations. We're going to have the rubric, and what you want to encourage the students to do is pull the rubric up when somebody presents a case, like later on this semester. And you're right. You want the students to look at the rubric and say, these are areas that you're going to be graded on, and they talk about it, and then you just clean up. Let them understand the rubric as they watch it, knowing what the student should be doing. Again, they're learning, and they're going to learn how to give good feedback too, because that's part of what we do in medicine, right?
Yeah. Yeah. When I tell the students they're going to give each other feedback, I tell them to give each other high quality feedback. So it's not like, oh, that was just great. Everything was wonderful. If you say everything's great, you tell them what was good. And if there's something missing, you step up and say something's missing. So. Okay. So you've reviewed, you've played a blog, you have gotten the students to give feedback to each other, you've given feedback to each other, and then you're going to go on and play your next blog. And your next blog might look totally different depending on what case they had. I'm trying to think. So this blog, I think, was a direct link. I wanted to show it just to show that most of them are much easier to get to. So this is an address, so it's going to just go play the video, which is nice. You don't have to download it.
It's not sharing audio because you have to click that when you hit share at the bottom. Share, optimize for video and audio. When you hit share, it's fine.
Okay.
So give us a
Still-
rundown, if you wouldn't mind, of play-by-play when we get to lab Monday, as we pull a schedule, right?
Yeah.
We know who students are in there. We pull 3 copies of rubrics, or we print those, so we have those in hand for feedback. And then during the session, we kind of take roll, right? And then we just go through and pick a video from each one of those 3 sessions, and then come back and do more and let them feedback until we run out of time. Is that correct?
That's correct. The other thing I'll say that I saw happen last year is that, as the students log into your waiting room, you're going to take roll. And I'm a paper person, so I like to actually have this on paper so I can just check off that they were there. And then suddenly you'll see somebody in your room that's not on your roll. And rather than, because we don't have a lot of time, I just pencil them in and then add it to the document later saying that the student attended on my session. So they get attendance. They get credit for showing up. It's just not worth trying to get them into the right room with such little time.
Hey,
And
Danielle.
if they have a dumb name, make sure they change their name to the accurate name so you can.
Yeah.
Hey,
Yeah.
Danielle, can I ask you a question?
Sure.
They're all gonna be in like that hour that Chris has, right? They're all gonna be in there at the same time.
Yes.
They're
Uh-huh.
all gonna be seeing the same.
Yeah, they're going to
on
be
video.
seeing what you're sharing
Okay.
on Blackboard. They're going to be seeing that video.
How many sessions we have? 3 or 4?
We have 4. Not everybody is on for the 4th session because
Okay.
we didn't need that many. So yeah, go ahead and print off your schedules, or if you don't like to kill trees, just figure out how you'll navigate during your
Oh, we're
Blackboard.
good at killing trees. We got that worked out.
Yeah. I have to kill trees to do this activity. I have to admit, but now Dr. Douglas can probably never touch a piece of paper and get along just fine because she's one of those younger.
Thank you for that, but no, I kill trees too. It's fine.
Okay. All right. What questions do you have? Anybody?
All right, so I'm a slow learner, okay?
Yeah.
They're gonna fill the blogs up in our individual blog areas.
Correct.
And like you said, we click on them and review them with them in real time then when they're on the Zoom.
Mm-hmm.
Give them feedback. It's not graded,
Right.
formative, right?
That's correct. Yes.
My favorite.
And remember, the students are going to give each other feedback, and we're just going to interject, at the last minute to say anything else that wasn't brought up. Like, I really liked how you oriented the patient that the encounter was closing, or I think you did a good job, but I did not see where you did the art loop to make sure the patient understood the information.
And we
Yes.
should get it through each group's blog video.
We will not be able to look at all the videos for each group in the time allotted.
All right. So basically,
So if you
somebody
just,
could do a lousy job and we never see it because their blog is not viewed.
yes, that could happen. But hopefully they will learn
Yeah.
from watching the
Yeah.
good ones and recognize, oh, that didn't,
Okay.
We all
Yeah.
learn from lousy jobs, right?
yeah.
Is the
But-
sorry. The schedule is obviously under the schedule tab.
No, it's
That would make too
actually,
much sense. Sorry.
let me get that back up for you. It's actually under, let's see, did I get shared?
No, it's there.
Well,
You're right. It's in that week 2 folder.
yeah, it's in the
Yeah.
week 2 folder, but it's not under schedules like right here. It's
Oh, we'll put
under,
it there. It's not
Okay.
gonna-
okay, but under giving the assessment and plan, the second item on their lab 1, giving the assessment plan schedule.
Gotcha. Thank you.
Mhm.
I'll put it in the schedules too. So we'll put it everywhere.
Okay,
If you're kind of questioning the same thing, well, there's going to be at least a handful of our 5 million students are going to question the same thing too, right?
sure.
I mean,
Yeah.
it's crazy to look for the schedule under a schedule tab, don't you think?
No,
Well-
I think that's a very good idea. I'm glad
I'm
you brought
sorry,
that up.
it's Friday and I'm cranky.
So
I
click on
teased
the
Jane
tab.
this morning. Because the attached file where you are, I
Uh-huh.
said, "You're making me deal with buttocks and donkeys." And he said, "What?" And I said, "Giving the assessment."
Oh,
So
no.
click on schedule tab and I'll give you information about that as a course director is, if you'll look, we scroll down, we have all of these activities require schedules. And so this is a lab activity, but we just finished the pods like a day or two ago of the students and how they're going to be paired in all activities. And so this is just an early activity, it is essentially a lab activity and will be put in the lab folder, but it's just not been put there yet because of the newness of everything. So yes, it will be under schedules and all schedules will be there, so they won't be able to find it.
Great.
It's just, yeah, brand new.
Thanks. Sorry to give you a hard time. You would
No,
expect
that-
nothing less.
This is what we are setting out to do here, is just to pound out any little kinks or questions. So, and I'll be around today if anybody wants to go through it step by step. Be happy to do that.
Yeah, Kip, I appreciate you just say it, and so we can clarify. Everybody else just kind of doesn't say anything, and then they say, look how crazy that is. The schedule is not even under the schedule tab. They just talk about us behind their back. So I appreciate Kip just took my
Full frontal
thing.
attack, sir.
Yeah, so that way I can be clear and transparent, right?
Yes, sir.
But just so while we're finished and while we're on here, this is very similar to case presentations. The getting them ready for that second semester is they will present to the cameras like they did the second semester, but then we will go in as a group and watch those videos on Beeline and grade them. So that way they'll get an idea of their scores, and we'll also let the group give feedback according to the rubric. Does that make sense?
Mhm.
So by the spring, the grades are legit, and we will get them at a much higher level and have them really ready to hit rotations and be confident in presenting your cases. You know what I mean?
Awesome.
Yeah.
So
So
this
so
format-
so you'll be seeing this again.
That makes sense.
So good timing, Dr. Darter, on this format. So that gets them ready for the new and improved case presentation format. Yeah.
Yeah, that will start in the spring, not until spring, right?
No, we'll start it. No, that's
Oh.
the next
Oh,
one.
okay.
They will do 2 encounters for every encounter coming up. I mean, I know our training's over, but just give y'all a heads up that are in here, is they'll do an encounter. They'll write a note, and then they'll get feedback from the SP on that first encounter.
Mm-hmm.
And then they'll do another encounter, write a note, and then they'll present the case. And then that'll be recorded.
Okay.
They'll do a difficult patient on this SPE and then a regular, problem focused visit. The
Okay.
second will be a OMT and a problem focus. And then the third one will be just 2 problem focus. So we're going to get them ready for their OSCE in the fall. But anyway,
Okay. I just didn't know we were going to do the grading thing this
I want
fall.
to grade them because, we all know what gets students' attention.
Grades. Yeah.
Hey,
Test.
scores, numbers.
Yeah. Absolutely. Okay. Well, just give me a shout if you have any questions once you play with this for a little bit, and we'll have great fun on Monday.
What
Thanks.
could possibly happen? Thank
Oh,
you.
gee.
Did he really say that?
Yeah,
I know
he
he
just
did.
really just jinxed me.
He
For
put us
sure.
all in Titanic just now. but-
Yeah, I'm going to stop
I've
the
got to come to
recording.
Knoxville later. I'll get them. Don't worry.